Welcome back to UC Davis Live, COVID-19. Where will the next pandemic come from? As more people move into wild habitats around the world, they can come into contact with viruses that circulate in wild animals, such as Ebola or coronaviruses. And these new viruses could bring new pandemics. Joining us today are two UC Davis experts who are working to develop ways to detect new emerging viruses and stop them from spreading. Christine Kreuter-Johnson is a professor of epidemiology and ecosystem health, associate director of the One Health Institute, and director of the Epicenter for Disease Dynamics at the UC Davis School of Veterinary Medicine. Her research focuses on how diseases can spill over from animals to humans and then spread among people. And Marcela Uhart is a wildlife veterinarian and director of the Latin America program of the Karen C. Dreyer Wildlife Health Center and One Health Institute at UC Davis. She's a co-author on an international report published last week on biodiversity loss and pandemics, with her contributions focusing on the trade in wildlife. Marcela joins us today from Argentina, where she is based. Before we get started, I'd just like to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We are aware of others posting links saying that you have to pay to watch this video. Please do not click on those links. This is a free webcast, and we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. So Christine, let's start with you. Walk us through how a virus can go from wild animals to spreading as a global pandemic. What has to happen?
Thank you, Satiris. And I just want to say it's an honor to be here with everyone, especially my colleague, Marcy Uhart. So let's see, what causes a pandemic like the situation we're in now? It always starts with a close proximity interaction between a wild animal and a human, just the same way that COVID-19 spreads through close interactions amongst us. Occasionally, there's a domesticated species involved, like a livestock species such as chickens or pigs, which can sort of act as an intermediary where the disease passes first to them from a wild animal and then on to humans. And that makes sense because we have such close interactions with domesticated species. But we have been really, truly curious about how viruses have been jumping from wildlife to people for quite a long time. And especially we were wondering, what are all these close interactions that people are having with wildlife? How is this occurring around the world? So we did make a big effort to take stock of all the spillover events that have occurred around the world. And we actually found that there's a lot of interactions that people have with wildlife right around their homes or in fields or crops where they farm. And of course, also through hunting and trade of live wild animals in particular. And unfortunately, about 40% of the viruses that spill over from wildlife to people are able to spread among humans, meaning that they have this amazing capability actually of transmitting from one species to another, but then are able to go from human to human. And when there's sort of a global population that has no prior immunity to a new virus, as that happens with a novel virus that comes from wild animals, the conditions are then set for a pandemic to take off. And of course, we know accelerated global change is at the root cause of all of this. And I know we're going to get to talk a lot about that.
Right. And that's actually pretty impressive. 40%, that's almost half of viruses.
Yeah,
that's pretty incredible. So
yeah.
what do we know right now about the origins of SARS-CoV-2, which is the official name of the virus that causes COVID-19?
I can take that one. I guess there's very strong evidence that this new coronavirus came from a wild animal into humans. In fact, Chinese scientists found a virus in horseshoe bats that is a super close relative to the virus that causes COVID-19. So it's probably an ancestor to the current virus that's causing the pandemic. And we expected that bats are the natural reservoirs for these types of viruses. Based on decades of work, we know that this has been happening as a natural phenomenon where these types of coronaviruses spill over. In fact, there have been 5 in the last 2 decades that have spilled over from bats into humans that have caused disease in humans. And of course, we all know that the outbreak was first recognized in Wuhan. There are some exceptionally talented scientists there who had the tools and the skills to identify the new virus. And many of the initial cases that they identified were, of course, linked to a seafood market that also sold live animals. But the early data that was shared pretty early on in the epidemic in February actually indicated that around 4 of the 5 people that were the first patients that were detected with COVID-19 had actually not been to that market. So there's some some evidence that people were actually maybe infected elsewhere, or that there might have been cryptic spread of the virus in the community. And there's good evidence to think that spillover of these types of viruses is occurring in more rural areas, and is occurring more commonly than is recognized. And it really takes a huge amount of investigative work to bring an outbreak to its source, to be able to identify the source. And we expect that this kind of work can take years. We have to do extensive testing of archived specimens or older specimens that were saved from people and animals before the outbreak occurred. And we all know that this is incredibly important work. So there's major investigations underway, and people just need, I think, to be patient, because it does take a lot of time to bring all the evidence together.
And being that this virus, as we now are learning, can be spread by people who don't have symptoms, that must make it even harder to track down.
Yep. Cryptic, we call that cryptic transmission, because the transmission is occurring in the community and it's just unrecognized. And we expect that to happen for viruses that occur, especially in cases where people don't have ready access to healthcare, or may not even go to the doctor because the symptoms are not severe. So you can see how the lines of evidence really need to be put together, lots of different circumstantial pieces of evidence in both humans and animals. It really does speak towards the One Health approach that we're such a huge proponent of.
Right. Christine, you've been involved with the PREDICT project over the past 10 years, which was set up to anticipate and combat emerging pandemic threats. What exactly did PREDICT do, and what's happening right now with that work?
Yeah, thank you for that question. I mean, PREDICT was such a visionary, game-changing project. We worked with a whole network of scientists and colleagues that were all around the world, all working toward a common goal to enhance early detection of zoonotic diseases. It was, without a doubt, the largest One Health project in the world. We really brought proof of concept, I want to say, to the One Health paradigm by showing how important it is to improve capabilities in wildlife health, and how you can integrate animal and human surveillance all the way from the field in some really remote settings to the lab. We also connected scientists in over 60 laboratories and gave them the tools to detect any new virus, so any novel virus, not just the usual suspects that are typically identified in an outbreak, or when you've got, sick animals or sick people, the things that you usually test for. So this network was really remarkable in its productivity. We did over 1.3 million tests on animals and humans to look for new viruses. We discovered over 1,000 viruses, the vast majority of which are brand new to science. But our colleagues, the project did end. We had an extension, and we helped with the pandemic response through an emergency supplement. The project just recently did close, but we are all still really doing the same work. Our colleagues in Asia and Africa are actually leading the pandemic response. Quite a few of them were actually the very first to detect SARS-CoV in their country, showing that the outbreak had moved beyond China borders and was now an international pandemic. And like I said, they're still doing the work, and we're finding new ways to pick up the slack in terms of funding and resources, and especially knowing that the work is more important now than ever, of course.
Oh yeah, totally. Hopefully funding will come through for it, and work will continue. It sounds like you are able to do some work that you were doing before, but this is a very important thing, as we obviously are seeing right now. It affects every aspect of life across the entire globe.
Yeah, exactly. We couldn't agree more.
I'm sorry, go ahead.
No, I just said we couldn't agree more.
So we are taking audience questions. If you're watching us live, leave them in the comments section, and we'll work in as many as we can. And we actually have one viewer who is asking a question. This can go to either one of you. Jiang Xin, who's watching on YouTube, is asking, there was a pig to human H2N1 or H1N2 flu case in Canada yesterday. How should we be concerned about that?
Marcy, do you want to do that one?
Well, I mean, you can do it. Well, I'll just go ahead and give it a start. But I mean, the flus from transmission from swine to people happen very, very often. They happen in fairs very, very regularly. It's been documented in the US and in other places around the world many, many times. Usually it's just that event of transmission from the pigs to the people, and then it stops there. What we need to be concerned about is the sustained human-to-human transmission, right? And especially if it's a new virus that we don't know and that our bodies don't recognize as foreign and don't have antibodies for it. But you know, it's good to be alert, and yes, but we shouldn't be like, you know, over worried about every new event now, but definitely watching.
Right. So H1N1 or H1N2 doesn't present nearly as much of a risk of spreading or fatality as what we're having now, right?
Well, the previous H1N1 pandemic was, you know, definitely not that deadly. It did spread globally and cause a lot of cases worldwide, and of course some deaths too, and, you know, huge economic costs because travel was interrupted to many parts of the world. So it is not one that should raise no concern, but again, there has to be this sustained human-to-human transmission for us to be, you know, on the verge of an outbreak that concerns humans and can become pandemic. If it's only animal to humans at this point, then isolating those and, you know, not allowing transmission to go on is what we should do.
Right. Okay. So Marcy, last week, an international group, IPBES, issued a report that you co-authored on biodiversity and pandemics. Can you tell us a bit about the report and its findings?
Yeah, so this was a very interesting report. IPBES is the Intergovernmental Panel for Biodiversity and Ecosystem Services. So it's kind of a parallel to the IPCC, the one on climate change. And basically they finished a report on the status of biodiversity last year that, you know, brought a lot of attention because of the biodiversity crisis. So at one point in this pandemic, with the links or the suspected links between biodiversity loss and pandemic risk, they decided to host this workshop. So they brought together 22 experts from around the world, and I was very fortunate to be a part of that effort. And what we focused on was exactly that, combining all the scientific evidence that's out there to see if indeed nature degradation is linked to pandemic risk. And what we found is yes, and that the same drivers of biodiversity loss and climate change are also drivers for pandemic risk. And that is mostly land use change and agriculture expansion and intensification, and also the trade and consumption of wildlife, as Chris pointed out earlier on.
Okay, so let's break that down a little bit. So yeah, so let's talk about how, so you're saying that you have found, that the group has found that protecting biodiversity is an essential element of keeping pandemics from spreading amongst humans. So can you just talk a bit about in detail how that works?
Yes, exactly. It is the best buffer, right, that we could have. It is our best vaccine, to use a probably not a good term, but you know, we're so the other part of the report that is so interesting is that it actually uses the scientific findings to provide tons of policy recommendations. And one of the key points it makes is exactly that. We should no longer be reacting to pandemics. We should be preventing them from happening in the first place. Because the one thing we're learning from this experience is that we're not doing a very good job at containing it or even having a vaccine to treat people and save lives. And it's just costing us too much in all realms, right? Yes, definitely preserving biodiversity and keeping nature intact and those ecosystems functional with healthy wildlife and healthy ecosystems is what we need as that would be our biggest asset, actually, if we could manage to do that.
What's the significance of the trade in wildlife for disease outbreaks?
Well, we have seen that from many of the high-profile emerging diseases from the last few decades have come from the wildlife trade or consumption of wildlife. For example, HIV/AIDS originated from consumption of wildlife, same with Ebola. And then SARS emerged from the wildlife trade in Asia. And you even had a significant outbreak of monkeypox in the US that was caused by wildlife trade, specifically for the pet trade. that came into the US and infected several people there, not causing deaths and not becoming established as a disease in the US, but certainly a big scare. So we have tons of proof that the wildlife trade is very closely, and consumption of wildlife are very closely linked to pandemic risk.
Teha, who's watching on YouTube, is asking, he says, so instances of viral spillover happen a lot, but is it an issue when it's sustained?
When transmission is sustained, I think that was, yeah, to Dr. Uhart's point earlier. I mean, we do see spillover a lot, but we shouldn't really minimize that. You know, transmission of zoonotic diseases from animals to people places a huge global health burden around the world, and usually that really falls on, you know, poor livestock keepers or people that care for animals, in particular for their livelihood. But there's also a lot of diseases that are transmitted regularly from wild animals to people in all kinds of settings. In addition to the trade, we can have a pandemic, which by definition is really rapid spread of a new virus when the virus is brand new, so we don't have any immunity. And then when there's human to human transmission, so spread. So I think getting to the question at hand, it's because we're so connected globally. People contact people. Once a virus has that capability, especially if that capability is through respiratory transmission, we get really worried because it's almost impossible to stop it. So that's the situation we're in now.
Marcy, I was wondering, does being in South America give you a different perspective on pandemics compared to, say, being in the US?
I maybe, I would just say that I think one of the big lessons from this pandemic is that we were all globally and massively unprepared, regardless of where we live. And in some ways, there have been, you know, fewer differences than expected between, you know, the wealthier and not so wealthy countries around the world. That said, definitely, I think in these countries, you know, there has been a huge impact, and it's been very clear and obvious that the health systems or the healthcare systems were not very strong, or were lacking capacity in many ways, and else, you know, in some places people were, you know, dying because of lack of access to oxygen. I mean, you know, nothing really sophisticated, just bottled oxygen in a hospital setting. So that's extremely sad, and definitely something to really think about for the future. But again, we shouldn't be worried about responding as much as we should about preventing. And then I guess the other thing is also that the poverty and inequality, social inequality, is another huge, it's a cause and a consequence at the same time, because many people were not able to stay at home because they needed to go out to work every single day. You know, massive public transport is great for disease transmission, and that's what everybody has to use to go to work, you know, shopping in crowded markets because that's what you can access. So lack of hygiene, because, you know, there's tons of slums. You know, some of our countries now are facing over 50% poverty, and this is only going to make it worse. The future is pretty scary in terms of the economic and social impact of this going forward. So possibly different, but at the same time, you know, universally sad.
Right.
Can I just add one more thing? Because I think the work that Marcy did as part of the expert panel for the IPBES report is so fundamentally important, because we need to really change our thinking around pandemic prevention, and we need to really start to see the environment and ecosystems in particular, especially ecosystem integrity, as a way in which we protect ourselves from pandemics. So intact ecosystems have a regulatory sort of service that they provide us to regulate disease in wild animals, and wild animal populations have more or less a stable state for infectious diseases. And when there's massive, environmental change or impacts to ecosystems, species need to move around, they need to regroup, they need to adapt, and sometimes there's closer interactions with humans. So almost always that's going to result in an increased level of risk. And I think it really is important, and I'm so glad that this intergovernmental panel kind of took this really difficult task on to help us connect all the dots, to really make sure that we understand that we need to think about environmental health when we talk about land use and environmental change, which is a pretty big shift in paradigm thinking, I think. We've been thinking it, but I think, for us to have some of the more, policy-oriented people in the world thinking about this is really new.
And it is really the only way to move forward with prevention, because animals cross borders, people are, as you say, we're very connected. So people are, crossing the globe every day. So the only way really to get at it is to work together in an international way.
Yep, exactly. And be a little more proactive.
Right. With biodiversity,
yeah,
environments.
Definitely. And I think that the other, one of the key focuses of this report was, again, focusing on prevention. And sometimes the way to make these messages very clear is, in terms of cost. So there's a lot of numbers in that report saying, it'll cost you 100 times more to react and solve this problem once it's installed. And that's an estimate. It might cost a lot more than it would to invest in prevention. And we have to start to think in prevention, in these broader terms. It's not only about having a stock of vaccine or having a stock of medicine in a cabinet, or buying more respirators. We actually need a healthy environment. We need, healthy access to food, to clean water,
right,
and to let nature do its job. Basically, that's how we'll be protected. So it's
right.
The report actually really focuses on this term that was coined by ITBES last year, and they'll continue to focus on in a new assessment next year, which is about transformative change. And what that means is, just this new, very big, broad paradigm shift in the way we, especially how we consume and how we produce food and other resources.
Right. The old adage is true: an ounce of prevention is worth a pound of cure. And it's just,
absolutely.
in this case, it's just so obvious, right? Yeah.
And
Helena, who's watching on YouTube, is asking, what is the importance of migratory birds in the appearance of a new pandemic?
Dr. Uhart.
Yes, we're laughing because I was involved in a lot of avian influenza, the bird flu work in the past, and definitely they do have a role. Some of the most dangerous flu viruses, especially for poultry, are what we call highly pathogenic. That means they kill birds very quickly. So thus, wild birds don't survive them and won't be good carriers along migration. But some strains of bird flu don't harm them. Actually, water birds are the natural reservoirs of all influenza viruses. So therefore, yes, they carry them with them where they go. And what we do is what we should always do, which is we protect our poultry productions or our human populations. We do what we call biosecurity. So we just build a lot of safety around the places where we have all these crowded animals, so we avoid contact with the wild birds, and that's how we protect the industry and having to take any more drastic measures.
It sounds difficult. How do you protect your poultry? How do you protect wild birds from flying into your farm or your coop or however you're keeping the birds? It sounds like it's a really hard job.
It is, but it also points to what Dr. Jensen was saying earlier about, all these efforts of doing surveillance and being ahead of the game and knowing what's out there. So, countries are really encouraged to set up these programs where they're monitoring for influenza viruses when the migratory birds come, and thus they're prepared. And actually, in reality, poultry farms and turkey farms and things like that operate under very, very strict regulations. That is not the same for backyard animals, but those pose lower risk. And those poultry operations shouldn't be set right in the middle of, right by a pond where all these migratory birds are arriving. That wouldn't be smart at all. So there are these kind of indirect strategies where we can be smart about where we place our, food production and the way we manage this with a lot of security. And that doesn't always work. We have, with the COVID situation, we have massive outbreaks of COVID affecting mink farms, which is another point of the wildlife trade that we should be discussing very, very sincerely to the future, which is these massive farms where we, produce wild animals, many of which have been linked also to these outbreaks, like SARS was linked to some of these farms with, the palm civets and the raccoon dogs. And now today, Denmark is announcing it's going to kill 17 million mink because the COVID virus affecting those mink is mutating and it's transferring back to people. It's spilling back into people. And that new strain is different. And, they're concerned that they have to stop this now. And, it's just, I don't know, for me, it's hugely painful to think of, massively killing, millions of animals to control a disease. If we can prevent it, we should be doing that instead.
Absolutely. I mean, it's frightening to hear that, the virus is mutating, because then, it's possible that whatever vaccine comes down the line may not be protective against that one.
Exactly.
Yeah, and that was exactly what the health authorities in Denmark used as the science basis to why they would take this dramatic action of pulling all mink in the farms. Just because, as these vaccines are in production, they're against the, original strain, if you want to call it somehow, and then they might not be effective against this one. So, yeah.
It sounds like, you have to be very vigilant as a animal farmer, a producer of minks or meat or whatever, that you really have to be on top of things, because you could have an incident like this crop up and get out of control before you can stop it.
Yes, and I think that the how interconnected we are now makes it ever more difficult, right? That has changed, and it is actually one of the reasons why I think some of the emerging diseases from South America or the Amazon tropics haven't really expanded globally. It's, I think, because we're still relatively isolated and in some regards, and things get stuck in where they started. But yeah, it is a huge risk.
Again, we are taking audience questions, so if you're watching us live, just leave them in the comment section and we'll work in as many as we can. I wanted to ask you, how exactly do you go about surveillance for new viruses appearing in people?
I can start with that one. I think it's really important to provide them the tools so that so that we can detect new things, which is not typically how it's been done. So people, if you go to the doctor, to the hospital, they're going to test you for the usual suspects, right? Based on your symptoms, they'll test you for what they know is circulating. But we have sort of in our mind, based on the work that Dr. Uhart and I and others at the One Health Institute have been doing for the PREDICT project, where we really start to understand that there's these front lines of exposure around the world, where there's people that might not be most likely to have the usual thing. Of course, that the burden of disease is similar in other places, but there might also be what we call in veterinary medicine a zebra. Like you hear hoofbeats and you expect a horse, but once in a while it's a zebra. So getting people sort of the tools and capabilities and training to detect the zebras, I think, is really fundamentally important. But we have to remember too that that some of these regions that are the most at risk for emerging infections, they're typically tropical areas, they're especially rural populations. These are vulnerable, people who are occupationally exposed because they have to be occupationally exposed to animals in their livelihood. They may not have as much access to healthcare as they need. So really starting to see this in a more holistic way in terms of addressing some of those inequalities and making sure that actually pig farmers all around the world and people who work closely with wild animals actually need the best access to healthcare. And it needs to be, really advanced and really cutting edge to be able to have any kind of global immunity, if you will, to diseases that are emerging. But I think Dr. Uhart and I are also really like-minded in that you can't just stop there. We do need to improve human health and surveillance everywhere, but we also really need to strengthen wildlife health capabilities. I think we only understand a tiny fraction of the viruses that could be zoonotic and could be spilling over. We still have pieces of the puzzle to bring together in terms of how environmental change affects viruses and sort of when they're going to cause outbreaks in different species. And there's a number of sort of bad actor viruses that are already out there crossing over between species and maybe even infecting, farmed mink or raccoon dogs. And they're not even on our radar yet. So we really need to empower wildlife health as it's kind of been that third tier in the health paradigm where we've got, human health and development, and that's going okay, could be better. Livestock and animal production is a little bit worse, but still, phenomenally better off than wildlife health, which is just a really fraction of sort of the expertise and the talent that needs to be there, I think, to really help with pandemic prevention. And that's a bandwagon or soapbox, one of those.
Yeah.
No,
So it sounds like
sorry, if I may add, I that is another very key point that we also made in this report, and we're having many discussions because there is an organization that looks after animal health and the trade, but that is mostly for domestic animals, and and then we have the WHO for human health, and actually really wildlife health is just in this vacuum, in no man's land. And we can just see now so clearly how important it is and how much more we should be strengthening that, not only because of the risk to us, actually also because of what we were saying early on about biodiversity and healthy ecosystems and healthy wildlife being this buffer that we all need to prevent pandemics in the first place.
So it almost sounds like instead of just not encroaching into habitats, it's more like humans need to take on this stewardship role of these habitats.
Yep, exactly.
That would be such a nice change.
It's an imperative change. I mean, I think it's not lost on us because we work with wildlife, have for our careers, luckily for us, for decades. But we see species in massive decline. I mean, even in our lifetimes, the global abundance of species has dropped some like 80% or more. And we see species going extinct in our lifetime, and there's lessons to be learned there. For humankind as another species, that there's no guarantee for any of us that we have a place on this planet, and I think the rate of species extinctions and the role that environmental change and disease has played in that is a huge lesson for us to take note of.
Yeah, and if I may add, I mean, that is so true and so significant. And I want to point out to something that is in our hands to control, and that is the wildlife trade. And I'm saying this very clearly because a lot of what is traded is for pets, for example, and we could be living really happy lives with dogs and cats, and those pose not the same amount of harm. And actually 75% of the most threatened species are traded, and they're in that status of decline because of trade and consumption and overuse. So the US is and the European Union are the two largest importers of wildlife for the pet trade. It's millions of animals. And we assessed in the report, we assessed the value of the wildlife trade. So over the last 15 years, the value of the wildlife trade has increased by 500%. And since the 1980s, that is 40 years, it has increased for 2,000%. And most of what we get from that trade is, things that we could probably live without, many sub-products, fur for fashion and, pets and things like that. So I think we really need to start thinking about, some of our consumer habits again. And it's not only about whether we eat meat or not, and whether that meat is certified, or how we grow our crops, and those kinds of practices. But it also relates to the wildlife trade, especially and especially to the large farms and those that are extracted from nature.
Yeah, I mean, the live wild animal trade is really an exceptional risk that we're taking. I mean, we've talked about it, I think, before, Sotiris, but it actually is a perfect epidemiologic setting for like viruses to adapt and learn how to cross between species in very crowded conditions where animals are moved, across international boundaries. It's if you were to if you were going to design an experiment to sort of allow viruses to gain a function where they can become, go from an animal into a human, this is kind of the sort of experiment you would design, and
Right.
it is actually happening on a global scale. So, so it's pretty surprising that that more hasn't been done on that front. And we published a paper back in March that showed that animals that have declined in abundance. So again, this gets towards, loss of biodiversity, but animals that have really declined in the number of animals because they are exploited and in the wildlife trade have shared more than twice the number of zoonotic viruses with us than other animals that are giving viruses to people. So we know it's a documented risk. It also intuitively is a huge risk. So I couldn't agree with Dr. Uhart more on that point.
Right. I feel like, when it comes to things like preserving habitats and biodiversity and, tamping down on trade and wildlife, a lot of people feel like, oh, well, those are really like nice, lofty goals that are a nice thing to do. But actually what you're saying is that these things these things pose an existential threat not only to the animals in the habitat, but to human beings, if not for the species, then for the lives or even just the health for hundreds of thousands, if not millions of people. Like people could die because we're not taking care of this.
And yes, we would suggest that there's good evidence that will eventually be a worst case scenario. But we should also remember that the people that are engaged in the wildlife trade, they're exposed to zoonotic diseases on a regular daily basis. I mean, there's beyond these are big, pandemic threat viruses that are thankfully rare, but becoming more common. There's a ton of zoonotic diseases that people are exposed to when they handle wild animals. And when you're using those animals as pets, like primates as pets, to me is something that is just an inherently bad idea on so many levels. Never mind, most of these primate species are threatened or endangered, but because of the number of viruses and bacteria and protozoa, and you name the type of pathogen, if a primate has it, we can probably get it. And we can also give our viruses and bacteria to them. And then that situation that's happening with mink is a big phenomenon that's happening all over the world as well. So it's the back and forth transmission and then the secondary evolution in those animal hosts that is pretty concerning as well. So yeah, I think we definitely are like-minded on that front.
Definitely, and I think that, again, of course, for, us in our daily lives, we can make, the choices we consider most appropriate and more aligned with our vision and how to take care. But, overall for, policymakers, governments, and you name it, I mean, I think that the economics behind this point to some very clear facts. I mean, this is extremely costly, and I don't think we're even considering that. Like, we've been locked down in South America and all countries now since March. There's been no schools. I mean, who is considering the impact on those future generations of adults who will have missed this much of their education? I mean, there are calculations by the what is it? Inter-Iberican Bank. I'm not saying that it's Banco Interamericano de Desarrollo. I'll say it in Spanish because that's what I manage better. But there have been these estimates now about the costs. Really, it's in the millions, and I mean it's measured in units of gross income product for countries. the impact this is going to have into the future. I mean, it's not even now, it's in the next decade or so that we're going to see this. So if we continue to build on one after the other of these events, there'll be no recovery time, right? We're all waiting until the day that we're all set loose again and back to normal. But what if that doesn't happen because we get hammered by another one?
Right, right. So as we have viruses spilling over to humans from animals, how can we prevent them from establishing and spreading more widely?
I mean, we can both speak towards that. I mean, it gets back to what we were just describing in terms of all the best practices that we know should exist in terms of, we call it biosecurity, but basically keeping, if we're rearing livestock or animals in any way in crowded conditions, we need to handle that in utmost care to make sure that diseases can't be transmitted to them from wildlife. And we have, best practices in some developing countries, but there's a lot of countries that are just starting to come on board with mass production. And it's a pretty resource intense prospect to do biosecurity well. So we need to take care of that. And then, as we were saying before, I think we really need to have surveillance on those front lines at the animal-human interface. We need surveillance on the animal side and the human side. People need access to healthcare. We need to do it in an equitable way so that the most at-risk populations are taken care of. And I think if we all work together on that, and I can't emphasize the importance of international collaboration in all of this, which has taken a bit of a backseat lately, which is really unfortunate. If we don't have good collaboration between colleagues and scientists, not only between animal expertise and human expertise, because you need to have a personal relationship that way. You need to foster that and support that so that if there's an outbreak, people can work nimbly between animal health and human health, and including wildlife health. But we also need to be able to call each other across countries and feel comfortable and have trust with, hey, we found a new thing. Why don't we share this finding? Why don't we share this information and these materials and all work on it together? And there's a lot of the international collaborative spirit that is essential to us protecting each other from pandemics.
Yes, I mean, and then there's some interesting, prospects going forward. I mean, the UK is passing legislation on, restriction importation of beef from countries that cause deforestation to produce that beef. So, there you go again. I mean, I keep coming back to this economic side of it, because ultimately that drives a lot of the decisions in many places. So, there's so many mechanisms and so many things that, when you start to look at each piece of this puzzle separately and intimately, you start to see just how many things we don't really do well. Now that with very little change, we could actually do so much better to be protected. And, we could, if we insist, or it's important for some people's livelihood to continue to trade wildlife, well, we could choose what species we trade very carefully. We could say, trading parts of animals that are no longer live is okay to some extent if the species is not endangered and it's not causing a threat to the wildlife population. But also, just eliminating these live animal markets that pose such huge risk. So there are different aspects of all of these chains of consumption and production that we could be tackling, with resources, of course, but, the gains will be a lot more than the losses, definitely.
Yeah, there's definitely that tension, that economic tension. People are trying to make a living, but at the same time, so it sounds like there has to be a really widespread and coordinated approach, industry by industry, field by field. And it sounds like the work that you're doing is helping us to figure out how to do it and what needs to be done, which is really great.
We're trying.
Yeah, there's hope for the future. Absolutely. I mean, I think for the first time ever, in the world trying to meet the Sustainable Development Goals, they're starting to talk to nations about, well, how are you doing that while ensuring biodiversity? And really embracing at a level that I've never seen before, this One Health approach and the momentum around recognizing One Health, which of course, first and foremost, people think, well, we share disease with animals. Okay, we get it. And we're like, no, that's only a tiny part of the problem. That, the environment is fundamentally underpinning environmental health, underpinning all that we know is needed in terms of One Health action. And I think One Health is definitely having its day in the sun on the international, intergovernmental level. And I think that is super promising.
Yeah, and I think another important thing that we rarely consider is that so much of what we use nowadays to cure ourselves comes from nature. A big section of that report is about, the genetic resources and the resources in nature. Did you know that 75% of antimicrobials come from natural products? So we've exploited nature very deeply to access that. Actually, I always use, the star anise that we use in cooking so much, the famous oseltamivir, the drug in Tamiflu came from that plant originally, right? So we kind of forget that in our synthetic world nowadays, our ideas come from nature first, and that's where we then copy many of these cures. And I want to wrap that up by saying also that many times the reason we know about those resources, they're available to us, is because of indigenous knowledge, and the indigenous peoples have centuries of knowledge accumulated to do things right in a lot better way, in a much better, healthier relationship with nature than we do. So a lesson to be learned there too, something to listen to really a lot more.
Yeah,
take their wisdom into account.
Yeah. The fact that human well-being is dependent on the environment is not lost on them.
Exactly.
Nor should it be on us. We're not insulated. Thought we were.
Right. Well, this has been really great and, so important in understanding and trying to prevent future pandemics. So thank you so much for all the work you're doing and for joining us today.
Thank you. Thank you for the invitation.
Yeah, thank you.
Christine Kreuter-Johnson is a professor at the UC Davis School of Veterinary Medicine. She's also Associate Director of the One Health Institute and Director of the Epicenter for Disease Dynamics. And Marcella Uhart is a wildlife veterinarian and Director of the Latin America program of the Karen C. Dreyer Wildlife Health Center and One Health Institute at UC Davis. On the next UC Davis Live COVID-19, as we approach the holiday season, we'll look into how to celebrate the holidays while keeping the risk of exposure to the virus low. Until next time, I'm Satirius Johnson, and this is UC Davis Live COVID-19.
Thank you.